Uh, as you may or may not know, I'm in, I would say, not hostile territory, but I am a member of the state Tennessee Board of Nursing. I was appointed by Governor Haslam and then reappointed by Governor Lee. I'm on my second term with about 2 years remaining. And so I have a different perspective on this a little bit. You know, I don't, I was chosen, I guess I'll go back and say I was chosen, the way I understand it, by Governor Haslam because I'm a pilot. As a pilot, we equate, you know, closely with doctors and MDs. We're fairly highly educated, skilled people. You know, we work with teams of people as we try to accomplish a task. And that task is literally on a daily basis, really more so for you because of what you do, but it's literally life and death. And so that's why I was appointed the public member to the nursing board. I have a greater appreciation of what nurses and doctors do. I've never had not appreciated nurses and doctors, but really when I got into the nursing board, it was really, really eye-opening, some of the things that I had no idea about. And so I'm obviously familiar with the nurse's position on this. There are questions in my mind. I can see it's not a yes or no answer for me right now. There are areas in Tennessee that really have limited doctors. As I've understood it, some of the East Tennessee counties, you know, there's one OBGYN for 3 or 4 counties. And some of these places really, the only access they have to health care would be nurse practitioners. As far as the supervisory role over the nurses and the entire scope of practice, I think one of the great things one of the things that I think would really benefit both groups is something that hasn't really, in my opinion, you may disagree, I don't know, the nurses and the doctors really disagree on this, and there's not really any middle ground. And so, you know, I kind of go with the SALT. There's an acronym SALT, and that's, you know, start a conversation, ask a question, listen, and then talk. And I think instead of a yes or no answer right now, it's more of a nuanced thing that maybe we can get the nurses and the doctors together and really have a productive conversation about this scope of practice thing and go from there. I'm not yes or no right now. I guess that's a politician answer, but I truly do think there's an answer in there, and we can find the common ground.
All right. Thank you. We'll move on into the next question. There's a lot of difficult decisions being made today that force business owners, parents, policymakers, all of us to balance personal physical health and our community's health with the economic health and that desire to get back to business. Can you talk about your thought process when faced with those challenges as a potential policymaker? Absolutely.
I'm a limited government conservative Republican. I don't believe the government should really be mandating anything. I believe they should give the general public the information they need to make informed decisions. I think that should be a top priority, of course. And I believe in individual responsibility. We're lacking a lot of that today. I'm not a doctor, and I didn't stay at a Holiday Inn Express last night. I'm not a virologist. You know, and for the general public, you see so much conflicting information every day. We need to do a better job informing the citizens, getting them on board. The conflicting information for me is, you know, there's some cities who are really on lockdown mode and have been for a while. They have masks, mask requirements, strict mask requirements, and yet their numbers are going up. And then there's cities with the same strict mask requirements and their numbers are going down. So I don't believe in mandating that, but I do believe that people should adhere to what the doctors and the nurses say, but and the public health officials. But it's something that really really is more nuanced again than either yes or no, but I do not believe that the government should mandate masks. I think they should more recommend masks or whatever they need. As far as businesses go, I believe we should not be telling businesses, we shouldn't be picking winners and losers in this deal. So big box stores can stay open, but mom and pop stores can't stay open. Certain restaurants can be open, yet smaller restaurants can't be open. Again, I'm not for mandating that. I think individual responsibility, personal responsibility should be the rule of the day.
All right, great. So next question is, inevitably our state's going to face, some economic challenges due to revenue decreases, mostly associated with the pandemic. How are you going to prioritize any of those inevitable cuts, and would you foresee cuts being made in healthcare?
Yes, there are going to be cuts, I believe. Governor Lee had added a few $1 billion to the budget this year before COVID-19 hit. The General Assembly worked that back down using some creative techniques and getting into the reserves, but there are definitely going to have to be cuts made. 46%, I mean, roughly half of our state budget is health and social services. The other 25% or 30%, however you want to look at it, is education. So between those two things, healthcare and education, that's 75% of our budget. Those are two of my top priorities, education and health and public safety. And no, I don't think those two areas, that 75% is where we cut. I think if you're going to have to cut, you're going to have to cut in that 25% that's remaining. Some of the issues you can look at, true criminal justice reform. I think if you reform the criminal justice system, did some of those really hard decisions to make. I mean, it cost us approximately, I think, $80 a day to house an inmate, and their budget is billions of dollars a year. So there's some cuts that we can make using common sense, working together, making some common sense decisions about budget cuts in that bottom 25%. But no, I would not cut healthcare or education.
Okay, great. Lee, thanks for taking the time to answer those questions. We've got a couple of minutes left. Are there other topics you want to talk about or expand upon with us tonight?
No, I mean, I've been around for a while. The former chairman of the Republican Party, the current District 32 committee man for the state Republican Party. I've never held a paid political office. This is kind of my first go at that. And, I built my life around service to others. I'm on a lot of boards at Auburn University, where I graduated from. I'm on a lot of local boards. I serve on the board of governors at a local hospital, actually. And I want to continue that service in the state legislature. I believe in term limits. I believe 8 years would be my max for a House seat. And I just want the opportunity to serve, and I really appreciate you having me here tonight.
Well, that sounds great, Lee. Thank you for joining us tonight, and good luck to you on the campaign trail, and maybe we'll see you down the road.
All right. Thank you, Doctor. Thanks for having me.
All right. Have a good evening.